A critical lifeline for Glenn County communities is closing. The Glenn Medical Center will close in a matter of weeks, and this week they were forced to close their emergency room.
We are a lifeline for a lot of folks in the Willows community, but also greater Glenn County. People in this community, they don't have transportation, they don't have reliable gas money to get to places like Enloe or Colusa if they have an emergency.
The hospital administrator says the federal government will no longer consider them a critical access hospital, meaning the loss of a key lifeline of funding. They are just one of several rural hospitals that have been at risk of closing for other financial reasons. Others are in Inyo, Modoc, San Benito counties.
With Medi-Cal not paying what it costs to serve the public, and with Medi-Cal essentially going bankrupt because of bad policy decisions by the Democrats and Gavin Newsom. So, the blame, really needs to go at some of these policies that have really undermined the ability of rural hospitals to survive.
When they did an expansion on Medi-Cal, they expanded a broken program without fixing the issues that our hospitals are going through when it comes to the utility costs, insurance costs, employee payroll tax, that we expanded a program that doesn't reimburse properly.
It's the result of issues that both state and federal lawmakers have known for years. Joining us now, the CEO of the California State Association of Counties, Graham Canals. Thank you so much for being with us.
Good to be here.
All right, so first I want to start with just what is the impact broadly on counties, maybe across California, if even just one of these hospitals close?
Well, it's significant, Ashley. I mean, it's truly significant. These hospitals are the lifeline in communities, and the communities that we're talking about, Inyo, San Benito, Modoc, even in rural Riverside, they're no longer going to have access to a hospital. So if a person wants to give a childbirth, have childbirth, for example, in Inyo County, they'll need to drive nearly 4 hours to do that. 4 hours. There'll be no emergency room in Glenn County. So, and these don't just impact those that are on Medi-Cal. These hospital closures impact the entire community. So for those that have private insurance, they too will not have a place to go. So it impacts everyone in the community. And
emergency and ambulance services, I mean, how could there be ripple effects on those services across the state?
Well, those ripple effects happen when they need to now rely on larger health systems that are an hour, 2 hours, 4 hours away in order to help when there's a specialty service that is necessary, when there's a significant injury or trauma that occurs in those locations, because they won't have the capacity to deal with those. And from our perspective, that's completely unacceptable, and it was avoidable.
I mean, avoidable how?
Well, we've had challenges in the rural healthcare system and the healthcare system for many years. So that part of it isn't new. Federal government's part of that, state government's part of that, sure, absolutely. California receives bottom of the barrel in terms of federal funding per eligible Medi-Cal recipient, bottom of the barrel. So we start in a place where folks are hanging on by a thread. HR 1 then takes that and then eviscerates what is left. And so these hospitals in these communities, and the impacts are going to be in urban communities as well, there's no way to sustain themselves. The funding is being ripped out from under them. And then in our communities, counties are then responsible as the providers of last resort. And so we are then mandated to pick up and provide indigent care, but we don't have any funding to do that either. And so then what happens? You have folks that are essentially unable to get access to care that they critically need, or they're getting care that is at a much higher cost than it would be otherwise. Then they're perhaps losing access to their home. There's all sorts of challenges that may occur, and these are our community members. These are folks that live right down the street from us.
You mentioned HR 1, which is President Trump, the National Republicans' budget essentially for healthcare especially. How do you see that impacting the healthcare space? I know you mentioned eviscerating, but I mean, would there be more hospitals than just the 4 that we mentioned that could be at risk of closure with that?
100%. We're just at the beginning. HR 1 will pull $1 trillion out of the health system in this country. And a substantial portion of that certainly is going to impact California. And when that happens, hanging on by a thread turns into a free fall. And a free fall means payroll isn't being met. It means bankruptcies then begin to occur for these hospitals. It means communities will no longer have access to care. And there's another piece to this too, which is for those who are eligible for these services, they will be required to prove that they're working. And the truth is, healthcare does not pay your rent. That was true yesterday, and it's true under H.R. 1. And H.R. 1 then will require a bunch of folks to prove that they're working by taking time out of their day to not work, to not be paid, to then prove that they are being paid. And that doesn't make any sense at all. And so those folks who are eligible for Medi-Cal will then lose access to care also, and that's on top of hospitals no longer being able to fund the normal business.
We have about 20 seconds left, but just what could state leaders do to help alleviate the situation, if anything?
Well, first, we would hope that Congress comes back in and rescinds the devastation that is occurring under H.R. 1. To a degree that's not going to occur, the state is a critical partner of ours. So backfilling where they can is critically important so our communities have some access to resources. The other part of this is we are mandated, whether the state or federal government provides resources or not, to provide care to folks. And so we can't meet that mandate without cutting things like public safety, because that's where the vast majority of our local dollars are going. So we need the state to relieve us of mandates and to partner with us to preserve health care to those who need it the most.
All right. Graham Canals, we really appreciate it. We'll leave it right there. Thank you for being with us.
Thank you so much. Appreciate it.